Welcome to the self-evaluation episode of the ASCO University weekly podcast. My name is Rachel Freedman, and I'm a medical oncologist and clinical researcher in the Breast Oncology Center at Dana-Farber Cancer Institute. Today we feature a self-evaluation question on pre-malignant breast conditions and high-risk factors, and we begin by reading the question stem. A 45-year-old woman is referred to you to discuss management options after a breast biopsy reveals atypical hyperplasia. She underwent a biopsy after her first mammogram demonstrated calcifications. A core showed atypical ductal hyperplasia and excision revealed the same with calcifications removed. She's in good health, started menses at age 11, has had 2 pregnancies and 2 children with her first at age 25. She is premenopausal, not on oral contraception or hormone replacement therapy. She has a maternal aunt with breast cancer diagnosed at age 65. Her exam is unremarkable other than biopsy changes of her breast. Which of the following is the most appropriate next step? A. Initiate genetic testing. B. Recommend tamoxifen for 5 years. C. Check vitamin D levels. D. Initiate a screening breast MRI. Or E. Recommend consideration of bilateral mastectomies. The correct answer to this question is B. Recommend tamoxifen for 5 years. Tamoxifen for 5 years is a proven chemoprevention medication and is recommended for women with personal history of atypical hyperplasia or lobular neoplasia, as it can lead to more than a 50% decrease in breast cancer development. The benefits of tamoxifen in this setting have been consistently demonstrated in multiple Phase 3 randomized clinical trials with extended follow-up, including the International Breast Cancer Intervention Study and the NSABP P1 study. Briefly, genetic testing is not indicated as the patient does not have cancer or a strong family history. Similarly, screening breast MRI is only recommended for women with a 20% lifetime risk based on family history, and the patient presented in this case does not have this degree of risk. Bilateral mastectomies are a consideration for women at very high risk of developing breast cancer, but given the patient's age and risk, this would not likely be the best next step for this patient, is not medically indicated, and is not clearly better than continued screening alone or consideration of prevention offered by tamoxifen. While vitamin D has been associated with risk and prognosis in some studies, there is no consistent data to support its use in breast cancer prevention, and supplementation of low levels has not been shown to modify risk or prognosis. Thank you for listening to this week's episode of the ASCO University weekly podcast. For more information on the treatment of breast cancer and pre-malignant conditions, including opportunities for self-evaluation and board review, please visit the Comprehensive E-Learning Center at university.asco.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.